listening to Affect Autism, where affect is the #1 tool we use in supporting child development through playful interactions. Get 15% off any DIR 101 course, An Introduction to DIR and DIR Floor Time through icdl.com by using the promo code AFFECTA15. That's AFFECTA15. Welcome back, listeners. This is Daria Brown, and this week is part 2 of a podcast with speech and language pathologist Jolene Fernald. Let's go back and listen to the introduction again and get into parent questions from members of Affect Autism, which she will be answering this week on the topic of alternative and augmentative communication devices. This week I have speech and language pathologist Jolene Fernald. She has her PhD as well, and she is an expert DIR training leader, and she is in Newport Richey, Florida, just outside of Tampa. She's the Selective Mutism Clinic Coordinator at Jolene Fernald Pediatric Therapy Services. She's also an adjunct professor at Granite State College and the co-founder of Reconnections Education Center. She specializes in selective mutism and alternative and augmented communication?
Correct.
Welcome, Jolene. It's nice to have you on.
Thanks so much for having me.
On the topic of parents, I have a few parent questions for you if you're game for that.
Sure, I'd love to.
Okay, a parent asked about the AAC device spelling to communicate versus a picture-based device like Proloquo.
So they are two very different systems. Spelling to communicate is an offshoot from the rapid prompt method, RPM, which is an offshoot from facilitated communication, FC. So FC was kind of the original, and then these other models, if you will, are kind of from there. So the idea is that you have a partner, a communication partner that has a physical hand on your hand, helping to guide you with spelling out whatever you're trying to communicate. So that's the simple way of saying it. I'm not an expert in the spelling boards, but that is the process. And the background behind it is that the idea is that it's slowing you down for your motor planning with the brain-body disconnect, so that by being able to push through a board with the letters, it really slows everything down so that you can express yourself more definitively. That's what the spelling boards are. Proloquo is a picture-based system. It's a speech generating device. It does not require hand over hand. So it's a little bit more autonomous in the sense that, yes, you may utilize some support physically. I recommend hand under hand if you are going to do that, so that your communicator has the ability to remove their hand on their own and can feel very safe and confident doing that, as opposed to a hand over hand approach. And with any kind of speech generating device, so whether you're using Proloquo to Go, which is a common one, an accent device through Proloquo, which would look at the LAMP model, which is language acquisition through motor planning, whether it's a touch chat, there's a lot of different types of speech generating devices. I think personally, my preference is more to go the speech generating device because it does support more autonomy. It doesn't require that you have a communication partner that is trained in the device. For example, let's say you want to go to a restaurant and order your lunch. You would need with the boards to have somebody who's trained in reading your board so that you are spelling out WOULD, would, LIKE, like a hamburger. I can't even spell all of that together. But so you would require somebody right there with you to sort of translate to the clerk at the restaurant. Whereas with a speech generating device, when you get to the point of being more confident in there, you could say, I would like a hamburger, and that person's hearing that I would like a hamburger. So it's a little bit more universal in that sense, as well as my bias towards a speech generating device, it allows for much more novel communication, which is more developmental in nature, the way that we typically learn communication and language. Again, the autonomy piece of it. And then it is far more universal, where you can take it anywhere, and you don't have to have the same partner with you across the board. In my experience, spelling to communicate is a slightly more behaviorally based model. The systematic way of teaching it is a little bit more behavioral in nature. As far as the way that hierarchy, you are placed into a supported seat. You are required to sit, and move through the boards in a systematic way. And I want to clarify, I'm not an expert in the spelling boards. I am an expert in the speech generating devices, and I'm definitely, as a speech language pathologist, much more biased toward the speech generating devices for those reasons that I mentioned.
Now, I know the one takeaway I had from your conference presentation from the November Interdisciplinary Council on Development and Learning conference for DIR floor time was that sometimes parents will come in and they say, my child is non-speaking. I would like them to learn how to use an AAC device. And here's the AAC device. And all of a sudden, they're going to start talking. And you might have been exaggerating a little bit, but your point was that just like a human being doesn't learn to speak in a month or 2 or 6, it takes quite a while. Learning how to use an AAC device is a similar process that takes a long time. And sometimes you'll see parents want to give up and say, oh, it's not working. And if you could describe that process a little bit, that'd be great.
I use the analogy of exactly how a baby does become a speaker, typically, right? A neurotypical baby. They are bombarded with language input for the first 6 to 9 months of their life. So out of the womb, and then they're, goo goo gaga and, mama, baba, dada, all of those kind of pieces are thrown at them constantly. But it's not really until close to about 12 months before you start to hear that expression, right? The child starts to verbally communicate mama, dada, ya, or whatever their words might be, those first words, ba for bottle or something. But it takes about 12 months for them to produce that. And so for our expectation, when we start with an AAC system, we do expect, because the child is comprehending so much, we just expect that they're going to automatically have the motor plan and have the capability of just going to food and then to meats and then to hamburger, because that's what they want for dinner. When in fact, it may take you 3 to 5 months or more before the child is doing that completely spontaneously and on their own. So I absolutely encourage parents to stick it out, hang in there, because the process takes a long time for us to combine words in our neurotypical population. It can be up to a whole other 12 months, right? So it's not really until about the age of 24 months old that our kids start to combine 2 words at a time. And then 3 and 4 words and so on is around 3 to 4 years. So it's super important for us to get those devices in the hands of kids early on. It's very common for a lot of places to wait until the age of 8 or 9 years old. And by then, kids are extremely frustrated. I think that a lot of times that's when we start to see those negative behaviors, that frustration and so on come out, because kids can't access their communication. They can't share what their wants and needs are, and their hopes and wishes and dreams and ideas. And that is frustrating. So definitely start earlier. The other piece that a lot of people mention to me too is prerequisites for AAC. And there are no prerequisites for accessing a communication system. So for that family that asked you about spelling to communicate versus a picture symbol type of a system like Proloquo, a lot of people will say, well, you need to have symbolism or object awareness and cause effect and certain things in order to use a speech generating device. when in fact, think about, again, our typically developing infants, they don't have those skills until they have those skills, until they've been exposed to all of that language and so on. So there are no prerequisites. And yeah, I definitely am biased on those speech generating devices for the amazing, novel communication that they can generate and share. And you literally have access to, hundreds of thousands, and so many more. And there's spelling, there's an alphabet on there, on those devices too, that you can, if there's a word that you can't find or something that person is trying to communicate, they can go ahead and try to spell it out so that, you can try to guess and figure out what it is.
Now, I know a lot of parents panic when their children aren't speaking. And of course, we never know if that child will become verbal or not at the time, or maybe that there are predictors or something. But I know a lot of parents that said, my child didn't speak at all till they're age 6 or something like that. So in that case, would you still intervene early and verbal would still come, even though they're using AAC? How does that work together?
That's such a great question. Yes. So the literature and the research that we have actually shows that starting a device early actually can support more verbal language communication output. So in my opinion, and as a speech pathologist, my goal is communication first. And if talking comes, that's great. But I want the child to have the ability to communicate. And so I wouldn't wait. I definitely don't have a crystal ball. And those kids that I think, okay, based on these prognostic indicators, are probably not going to verbalize, use speech output down the line. Those are the ones that always show me up anyway. So I've given up over the years at trying to make those predictions. And instead, I just support whatever method and whatever model seems to work best for that child. For some kids, it may be that speech generating device. For other kids, it may be spelling out, on their a text to speech option on their iPad or their cell phone. I have an amazing 16-year-old gal that I'm working with right now. She came to me specifically for situational mutism because she wanted to be a much more confident communicator. But she's amazing using her phone. Her text to speech app is fantastic. And so I asked her, I said, what's wrong with that? Why aren't you enjoying using this? And she said, well, it's definitely not as efficient as, my verbal speech is. And I said, but are you able to access it all the time? And she said, yeah. And I said, so I don't know that it's as much, an issue with your not being comfortable, but that maybe you feel like other people are not as patient as they should be in that communication situation. And that reframe for her really gave her so much more confidence. We're still working on her being able to kind of calm and regulate a little bit more. So maybe she can use her verbal communication at other times, but really right now she's a fabulous communicator. I wish all of my kids could be as easily able to access their technology that way. And so, yeah, I would encourage families to start as young as possible, because it will alleviate so much of that frustration and so much of that stress. And then you'll really know what your child needs, what their preferences are, and give them the ability to advocate earlier on, so that when it's time, perhaps for that speech output to come, that will just kind of naturally flow into that next step.
And what is the most surprising outcome you've seen in any of your 2,000 kids that you have worked with? Did anyone, maybe they didn't start speaking until they were a teenager or something like that?
I mean, with selective mutism, the most of them are actually verbal pretty quickly. The typical treatment time for my kids with selective mutism is between 9 and 12 months. So, and that usually within 2 or 3 sessions, they're verbal with me. And then it's just a matter of helping them figure out that regulation and support that, all of their individual differences that help support that regulation, so that they can be confident communicators outside of my space. So for SM, I don't know that I've had any, they're all amazing when having parents call me or or text me that, their child got in trouble for talking too loudly in their classroom. We celebrate those moments where most parents would be mortified, that their kids are getting in trouble, but we're cheering and saying, hooray, he got called to the principal's office for being too noisy in the library or whatever. So those are pretty amazing, surprising moments. Probably my biggest story for me not knowing what I was doing, or whatever you want to say, but one of my families that I worked with, the child was 3 when I had him, and I had him from the age of 3 to about 7, and then I shifted school districts. I was working in the schools at the time, and he was one of those kids that I thought was never going to be a verbal communicator. I really questioned cognition. I was way younger then. I didn't presume competence the way that I do now. I have to admit, I've learned a lot over the years. So I really looked at, this kiddo he's going to struggle, was really what I saw at the time. Again, I've learned a lot since then. And his mom just reached out to me last year, and he's working for NASA now as an engineer, and is a genius, and clearly very verbal and able to get his needs met. And so, I'm not going to say that it's really exciting to see. That probably is my biggest, and my biggest sadness for myself as a professional, that I shortchanged somebody who had so much potential. And that's what I love about the DIR perspective. Instead of looking at what kids can't do, reframing that to what are their capabilities and their capacities, so that I can support them to achieve whatever they want to achieve.
And the key being, you will support them, as opposed to,
right,
I'm going to be their therapist and I'm the one that knows, and you're the client. It's you're supporting them. And that's really
Absolutely
what DIR is about.
Yeah, absolutely. Instead of my saying, I'm going to get you to talk, which is where I was before. That was my headspace early on in my career. Now it's, what do I need to do? And again, I take the onus on myself. What do I need to do to support you to achieve what you are capable of? And that flip, it seems really subtle, but it's everything. It really has completely changed the way that I practice. And it goes back to the foundation of our school. It goes back to, the floor time intervention that I provide as a speech pathologist. It truly is, it's the cornerstone of everything that I do.
Wonderful, wonderful. Okay, another parent asks, we're just starting out with Proloquo to go, and I'm wondering about tips for respectfully introducing the program in a way that doesn't feel compliance-based. My daughter is 3.5 and non-speaking. Right now, we're just exploring a few buttons together, and I press them to casually narrate a few things as we go about our day. I'm wondering the best way to start branching out from here.
Also a great question. I think exactly what you're doing is where I would start. Proloquo is set up a little bit differently from some other programs. And there are a couple things that I make sure that I tell families when they're using Proloquo, is to try to set it up not category based, but accessible to, yellow is always going to be in yellow spot, and food is always going to be in food spot, and go is always going to be in the same spot, so that those options are always there. So Proloquo is set up so that a lot of times we end up with different pages for, you might have a movie page or a book page or a, radio music page or something like that. Try not to do it that way. And then exactly that aided language stimulation is what this family is doing by modeling throughout the day and showing. Don't withhold food until she says, I want snack or whatever. Don't do that. And it sounds like this family's already kind of aware of that. But continuing to model it whenever she clearly brings you to the refrigerator. Oh, you wanted snack. And then you just model it on the device, or it's time for bed and put, sleep in there. The other key point that I often recommend is to highlight more verbs than nouns. Often it's easier for us to think about language in the terms of nouns, right? Things. So, goldfish or crackers or a snack that a child loves or a video or something like that. But really, the power words are those verbs. So try to show her those power words like go, stop, want, and then you can figure out what she wants from there. But those are really great words to start with moving forward.
And what if you had a blank slate, what is your go-to device that you will suggest to parents if it's your choice? And it's a hard question because some families are already invested in another choice and you don't want them to regret it and feel like they did the wrong thing. And so I don't even know if that's a fair question, but I imagine you get that question from families.
I do. There's a process that I recommend, and specific devices and systems they should be very individualized, and they should be based on the strengths of the child. That said, I found that for me, probably the most universal device or flexible device or whatever would be that Pranky-Romic accent device from which uses the language acquisition through motor planning, the LAMP model, because those symbols are always in the same location. So it uses the same theory that we use when we type. For example, when you learned where the home keys are on your keyboard, those keys don't move. And then, now I can have a full conversation and type something at the same time without having to look down at the keyboard. And so the idea is that our children and our communicators are learning that same motor plan on their communication device, and those symbols don't move and they don't shift. And you can generate, all kinds of types of sentences and language expressions and so on. So while it should be very individualized, and I have definitely recommended a lot of different options, I would say that my go-to is typically LAMP. And they have an app now too on the iPad, which I think gives some more flexibility for families who may not have $8,000 in insurance funding or whatever to purchase the regular, standalone dedicated device. You can spend $500, for an app on your iPad and still have the same level of access. And then you can modify your iPad with a key guard and some different options if you needed to help support your child that way. So I like that kind of flexibility, having it as an app, as well as having access on, a dedicated standard device on your own too.
I know I'm going to get this question. Do you offer virtual services for people that aren't in your area, who maybe want a consultation because of your expertise, who then may work with their local SLP going forward?
I do. If it's just a consult with families, I'm happy to go ahead and do that. I can do that anywhere. I am licensed in New Hampshire and Florida. So if it's particularly, where I need a child in that sense, for my licensure, I would have to look and see whether or not I can get licensed in a different state. But I'm happy to consult and just give some feedback for families. Absolutely.
Excellent. I do have a question about scripting, which is not totally related to everything we've been talking about, but it is a speech and language question. So a parent says, knowing that scripting is their child's current way of communicating, the parent tries to interact as often as possible. Sometimes the child is able to repeat a script with precise enunciation, while other times she'll say a first few words clearly and then mumble repetitively the words in between and properly pronounce the last few words in a script. It makes it difficult to engage at those times. Do you have suggestions for engaging when the child's in that mode?
Yeah. So I love scripting because I think it's kind of an initial introduction into communication for many of our kids. They don't have the motor planning of their own accord at that point. So the idea is that with motor planning, it's a 4-step process. You have an idea, you make a plan, you execute the plan, and then you modify, adapt as needed. Those are the 4 main steps for motor planning. So with scripting, the first part is that they have an idea and it's connected to an association, something that they may have seen, something that they may have heard. So the example, maybe you're talking about shoes and they link to Cinderella and her shoe. So they script something about, this magical shoe fitting or something. So to us, sometimes that seems really random and we can't figure out where that connection is. But within the motor planning, they get that first part, that idea, but the second part of make a plan and then execute the plan, do the plan out and then adapt, they struggle with those middle pieces. So again, the association is actually pretty cool if you can start to figure out where it's coming from your child. But the challenge is, of course, a lot of times it seems random. So I would encourage the family to continue to try to make those associations, try to link, continue to support that motor planning, and somewhere around FEDC 3 and 4, where we're getting more into that purposeful communication and social problem solving at 4. And then hopefully some of that will start to connect. Now, the reason that I think the jargon happens in the middle is also related to motor planning. And it can be a couple different things. Sometimes it can be actual motor planning where the sounds, there's kind of a kink from being able to get the brain to get the mouth to do what it's supposed to do for those individual sounds. Whereas other times it's sort of like a fluid process. So there's that side of things. And then the other piece has to do with more of a working memory level. So the child may retain more of whatever happened at the beginning, kind of what happened at the end, but the in between, they don't have it completely laid down in their memory. So it's more of a jargony, babble kind of middle piece. So that's what I would say would be the challenge with the scripting, is just not knowing where those ideas and those associations are coming from, but to continue to try to make that link as best you can, because also the child may be using it as a placeholder to process what you're saying, the way that echolalia would be used, or they're using it to initiate that interaction completely. And it's really just a matter of kind of teasing out which way they're using it.
Right. And I've given the example on the podcast a few times of scripts that my son uses when situations come up that remind him of things we've been through and things that we said in that occasion. He then says it in an appropriate way. And it's the type of thing that only I would know, because I was the one with him when him and I made that association. But if he said that at school, like the person at school would have no clue what he's talking about. So I think it's a natural thing that our kids do. And it's just an early developmental step.
And it can be related to an emotional experience, right? Some emotion that they're feeling. And so it may not be as literal as, well, you're talking about shoes and that's where Cinderella comes in. Your child may love princesses and it seems like all of a sudden that's everything is princesses, when in fact, maybe it's a feeling that they got when they were watching the movie with you, or maybe it's a frustration, it's the angry part where Cinderella is being made to clean, the floors, and you've just told your kiddo that they have to go clean their room. I mean, it could be any association. And unfortunately, it's more of a puzzle for us. We just don't know where that's coming from. But I would encourage families to know that it's coming from somewhere, that for your child, it's purposeful, and to treat it as purposeful as possible, when that experience is happening, to kind of go with the flow, follow that lead, and try to support them moving through that process. if it's a negative, what we would consider as a negative, big feeling, big emotion, let your child go through that whole big feeling, let them go through that whole big emotion, so that hopefully they can figure out and resolve on the other side, so that the next time they experience that, then it feels a little safer and it feels a little bit more manageable for them.
And I'll refer listeners to the podcast I did on scripting with Jahan Shahata Abu Bakr, because she's a speech language pathologist closer to me. And we talked about exactly what Jolene's mentioning, and there'll be some more examples in that podcast. The other question is, my daughter's starting to talk at home, limited with much scripting, but will sing to herself or mumble with some clear words while she plays. And she'll even script with her sibling and anyone who came over. But when they would go out to a family member's house or a playground, she would go silent, but she would still seek out other kids and just stand by them silently. So is the parents wondering, is this selective mutism? And if so, she doesn't seem to display other signs of anxiety and eagerly seeks people out. But then she won't script or say anything until she's in a demanding request mode. If she needs something like a bathroom or wants ice cream, and she'll use some words, some lead, and follow. What should the parent do?
Wow, there's so much there. So I think anxiety, let's not assume what anxiety ever looks like, because we can't really tell often from the outside. For a long time, I thought that anxiety was, a kiddo biting their fingernails and rocking in the corner, in the fetal position. That's what I pictured anxiety looking like. Your voice tremoring or dry mouth or whatever, but it really can be any of those, as well as for me, anxiety is actually being more of a perfectionist. So anxiety for me drives me forward to be a type A perfectionist. Whereas for some people, anxiety causes them to withdraw a little bit more and back up a little bit more. So for families, don't presume what anxiety looks like in your child, would be the first step. But secondly, I'm super encouraged that she's approaching kids on the playground or going out there. I think that's awesome. And a lot of our kids will try communicating in the home environment where it's safe and they have a little bit more control with their surroundings. And then when they get more confident using it in their home environment, that's when you'll start to see it transition and generalize out into more public situations. I'd be willing to guess that this child knows that mom or their sibling is going to hang out and be more patient and tolerate maybe more directive play or engaging with things that she may be interested in the home, where there's so much unpredictability and there's so much unknown when you go out into a playground and you don't know those kids, and you may be drawn to them, but you just don't quite know how to interact or open that circle up yet. So I think it's awesome. I think it's really encouraging that she's approaching. And I would continue with that same scripting conversation that we just had, as far as supporting scripting in that way, as well as the motor plan, and look at those other individual differences that may be the physical challenges of the playground, that the cognitive load is just too much and she can't navigate the visual spatial part or the motor planning to get up onto a slide at the same time as trying to access speech and language skills. It may be that she can't figure out that initial idea of what do I say, how do I open and engage at the same time that I'm doing this physical activity. So I think there's probably a number of things at play in this particular situation for this particular child. But I'm encouraged that she's at least approaching the kids. I don't know that it specifically meets the diagnostic criteria of SM, because it sounds like she's not maybe 100% verbal even at home consistently. So I would make sure that that's more what we're looking at. I think it's probably the cognitive load and maybe some of that stress within that situation that's probably impacting her ability to be as outgoing outside of the home.
And as you mentioned, there can't be a double diagnosis. So this child has an autism diagnosis, so would not get the SM diagnosis.
Right. And I should say too that while our DSM specifically says you're not supposed to have them as co-occurring diagnoses, there is no doubt in my mind that my daughter met the criteria for selective mutism at age 3, and she also met the criteria for autism through those ages, those years too. But we just chose not to go the autism side of things as a family. So there has been some research that shows a shared gene between kids. This was back when we still called it Asperger's, but so they looked at Asperger's and kids with selective mutism, and there's actually a shared genetic component between the two. And again, I prefer to just think of it from a profile perspective that yes, there were sensory differences, there were motor differences, there were communication differences, there were repetitive behaviors or specific interests and so on. I'd rather describe a child from those perspectives as opposed to any one particular label.
Absolutely. Well, thank you so much. This is Jolene's website, Jolene Fernald Pediatric Therapy Services. And I'll put links to all of this in the blog post at affectautism.com. Here's Reconnections Education Center, her new school. That is a DIR school supporting children who want a more developmental approach. You do not need an autism diagnosis. It is for children that need that extra support. So thank you so much, Jolene.
And you have some great questions from your families.
They'll be very grateful for the answers. So thank you for that as well.
My pleasure.
Until next time, here's to affecting autism through playful interactions. Thank you to the members of Affect Autism for submitting their questions for this week's podcast. If you would like to submit questions for upcoming podcasts, consider becoming a member of Affect Autism at the patreon.com/affectautism page. For as little as $5 US a month, you can be a member supporting the work that I do to bring DIR floor time implementation to you and your family and make it a little bit easier and add a lot of support. You have access to floor time videos, my weekly insights, and more. Check it out at patreon.com/affectautism.